Alert! Avoid eggs if you are on these 8 medications. Think eggs are the ultimate health food? Think again. If you're taking certain medications, that morning omelette could be doing more harm than good. Shocking, right? What if I told you the combination could weaken your meds, or even put your health at serious risk? Stick around because today, we're breaking down the hidden dangers of eggs and the meds you should never pair them with, from cholesterol-lowering drugs to antibiotics. The truth about these risky interactions might surprise you. Let's dive in before your next breakfast becomes a health hazard. Eggs are a nutritional powerhouse, celebrated for their high protein content, essential vitamins, and versatility in cooking. However, while eggs are generally a healthy addition to most diets, they may not be the best choice for everyone, particularly for individuals taking specific medications. The interaction between certain foods and drugs is an often overlooked aspect of health that can significantly affect the effectiveness and safety of prescribed treatments. This is where eggs, despite their numerous health benefits, can potentially pose a problem for those on certain medications. When taking medication, diet plays a crucial role in determining how well the body absorbs and processes these drugs. Certain foods, like eggs, can interfere with the way medications work by either enhancing or inhibiting their absorption or metabolism. For some drugs, this interference can lead to reduced effectiveness, unwanted side effects, or even serious health complications. Understanding these interactions is critical for patients and caregivers alike to ensure medications perform as intended without adverse effects. Eggs, particularly the yolks, are rich in nutrients such as proteins, fats, and choline, which may interact with medications in specific ways. For example, the high fat content in egg yolks can alter how certain drugs are absorbed into the bloodstream. Similarly, proteins in eggs may bind to medications, preventing their proper absorption. Additionally, eggs are a significant source of biotin, a B vitamin that may interfere with lab tests and certain drug mechanisms. Blood thinners, such as warfarin, Coumadin, and rivaroxaban, Xarelto, are essential for preventing blood clots. However, they require careful dietary management. Eggs themselves do not directly interact with blood thinners, but the vitamin K content of egg yolks can be significant in some contexts. Vitamin K plays a role in clotting, and its intake must be consistent for patients on warfarin. While eggs are not as high in vitamin K as leafy greens, consuming them excessively could still impact therapy. A study published in Nutrients highlights the need for consistent vitamin K intake for individuals on warfarin. Irregular vitamin K consumption may lead to fluctuations in blood clotting factors, increasing the risk of bleeding or clot formation. According to the American Heart Association, dietary sources of vitamin K, including eggs, must be monitored when using anticoagulants. Practical advice: monitor egg consumption to ensure it does not lead to a spike in vitamin K levels. Consult with a healthcare provider to establish safe dietary practices. 2. Cholesterol-lowering medications. Cholesterol-lowering medications, including statins, e.g., atorvastatin, are prescribed to manage high cholesterol levels. Eggs are known for their cholesterol content, with one large egg containing approximately 186 mg of cholesterol. While statins lower cholesterol by inhibiting its production in the liver, excessive dietary cholesterol may counteract these effects. A study in the American Journal of Clinical Nutrition revealed that moderate egg consumption does not significantly impact cholesterol levels in statin users. However, excessive intake may reduce medication efficacy. Research also suggests that dietary cholesterol affects individuals differently, with some being hyperresponders. Practical advice: limit egg consumption to 3 to 4 eggs per week if on statins or other cholesterol-lowering drugs. Discuss dietary cholesterol concerns with a physician, particularly if you are a hyperresponder. 3. Antibiotics. Antibiotics like tetracycline and ciprofloxacin are used to treat bacterial infections. Eggs are high in protein, which can bind to certain antibiotics and reduce their absorption in the gastrointestinal tract. This is particularly true for tetracyclines and fluoroquinolones, as these medications form complexes with calcium, magnesium, and other minerals in eggs. a study in antimicrobial agents and chemotherapy found that calcium-rich foods like eggs significantly reduced the absorption of tetracyclines. Another study in Journal of Clinical Pharmacology noted that concurrent consumption of fluoroquinolones with protein-rich foods delayed the peak plasma concentration of the drug. Practical advice: avoid consuming eggs within 2 hours of taking antibiotics, particularly tetracyclines or fluoroquinolones. Opt for light meals to ensure optimal medication absorption. For diabetes medications, such as metformin and insulin, regulate blood glucose levels. While eggs are a low glycemic food, their high fat and protein content can interfere with glucose metabolism. Additionally, eggs may increase cardiovascular risks in people with type 2 diabetes, potentially complicating treatment plans. A study in diabetes care found that regular egg consumption was linked to an increased risk of cardiovascular disease in diabetic individuals. However, another study in the American Journal of Clinical Nutrition noted that moderate egg consumption had no adverse effects on glycemic control. Practical advice: monitor egg intake, especially if you have pre-existing cardiovascular conditions. Discuss with your healthcare provider whether eggs fit into your individualized diabetes management plan. 5. Immunosuppressants. Immunosuppressants like cyclosporin and tacrolimus are prescribed to prevent organ transplant rejection or manage autoimmune diseases. Eggs may pose a risk due to potential contamination with Salmonella, a bacterium that can cause severe infections. Immunosuppressant users have compromised immune systems, making them more susceptible to foodborne illnesses. The Centers for Disease Control and Prevention, CDC, warns that raw or undercooked eggs are common sources of Salmonella. Immunocompromised individuals are advised to avoid these products. A study in clinical infectious diseases emphasized the importance of food safety in immunosuppressed populations to prevent severe infections. Practical advice: consume only fully cooked eggs to minimize the risk of Salmonella. Avoid homemade dressings or desserts containing raw eggs. 6. Certain antidepressants, e.g., MAO inhibitors, monoamine oxidase inhibitors, MAOIs, like phenelzine and tranylcypromine are used to treat depression and anxiety disorders. While eggs are not directly contraindicated, they are often paired with foods high in tyramine, e.g., cheese, cured meats, which can interact with MAOIs. Excessive tyramine can cause a hypertensive crisis in MAOI users. A study in psychopharmacology revealed that high tyramine diets could lead to dangerous blood pressure spikes in patients taking MAOIs. Eggs themselves are low in tyramine, but caution is needed regarding food pairings. Practical advice: pair eggs with low tyramine foods to avoid complications. Monitor blood pressure regularly when on MAOIs. 7. Acne medication. Acne medications like isotretinoin, Accutane, are highly effective but come with dietary considerations. Egg yolks are rich in vitamin A, and isotretinoin is a derivative of vitamin A. Excessive vitamin A intake can lead to toxicity, causing symptoms such as headache, dizziness, and liver damage. A study in dermatology reports noted that patients on isotretinoin should avoid high vitamin A diets to reduce the risk of hypervitaminosis A. The National Institutes of Health, NIH, recommends keeping vitamin A intake within recommended limits to avoid toxicity. Practical advice: limit egg yolk consumption while on isotretinoin. Regularly monitor liver function tests as recommended by your dermatologist. 8. Allergy medications or histamine blockers. Allergy medications, such as antihistamines and H2 blockers, control allergic reactions and acid reflux. Histamine blockers may interfere with the digestion of protein-rich foods like eggs, leading to bloating or discomfort. Additionally, some individuals with egg allergies may experience exacerbated symptoms if histamine-blocking medications alter gut permeability. A study in the Journal of Allergy and Clinical Immunology highlighted that individuals with egg allergies should exercise caution when consuming eggs, particularly if they rely on histamine blockers. Another study suggested that histamine levels in foods could influence allergy severity in sensitive individuals. Practical advice: if you experience bloating or discomfort after consuming eggs, consult your physician. Those with egg allergies should avoid eggs altogether, even when on histamine blockers.